way it makes people feel. That's what we're finding, is that people that are using it, maybe other reasons obviously for why they're doing it, but in most cases it's because of the way they feel. They want to feel better. They may have tried it at some point in their lifetimes and just got hooked essentially on that. I've talked to people who've tried it once and had a reaction to it that was so great, they loved it so much that they just couldn't stop. That's not unusual to have happen. There's other people, that have an injury or an illness and have to take opioids, and then it causes a problem for them when they try and stop it. Then they have that feeling that they like, and they want to continue that, they don't know how to do it legally, so they start going to the black market and getting different things. It progresses and progresses and progresses until there may be possibly the use of opioids that are illegal, so morphine or something else like that that they can buy really cheap.
Okay.
Well, I think that's obviously going to be up to the mother, really, because you can't stop somebody to have the child at home, right? If that person's there, is born with it, they're hoping that they're getting treatment that they need before, but they do find that it's like anything else. Let me start worrying about someone who's got an addiction to opioids or something. Are they doing something else? Are they injecting it? Are they heroin users? I mean, you're looking at HIV, you're looking at hepatitis after that. So all those issues start piling on top, where you start worrying about whether the person should breastfeed or not. But we can't stop a mother who leaves a hospital or leaves any care and goes and does what she wants. So trying to be proactive before that person leaves the hospital or whatever is something that people are trying to do. And some of the hospitals, the children remain longer often, more than most children, because they're actually being treated for abstinence syndrome and for some of the other issues that may have happened during the pregnancy.
So risk of opioid use in pregnancy has direct and indirect risk. So some of the direct risks we have to deal with are neonatal abstinence syndrome, stunted growth, preterm labor, fetal convulsions, and fetal death. Some of the indirect risks we have to deal with are increased risk of maternal infections like HIV and hepatitis, malnutrition and poor prenatal care, and dangers of drug-seeking behaviors, which could include domestic violence and human trafficking. So some of the options we have for treating mothers at risk for opioid use during pregnancy is actually medications that we can use. We can utilize Suboxone, and we can utilize methadone, so that we can try to taper those mothers off of opioids and street drugs. Part of the evidence-based practice shows that this is the better option. So some of the benefits of treatment with medical modalities during pregnancy is that we can stabilize the fetal levels of opioids and reduce the repeated prenatal withdrawal of the fetus while it's in utero. We can link mothers to treatment for infectious diseases that they may be having, such as hepatitis or HIV, provide opportunity for better prenatal care, and keep an eye on those those outside illicit drug uses, and then we can improve long-term health outcomes of the mother and the baby. By doing this, we can lower the risk of neonatal abstinence syndrome.
If a woman who's pregnant decides to just quit cold turkey, like maybe she hasn't asked for professional help and she doesn't really know what she's doing and she just wants to stop, does that period of time where she's going through withdrawals, does that increase the risk of stillborns or miscarriages?
Yes, it
things
does.
like that?
Yep, studies show that happens also. So again, you're stopping something that physiologically the body needs because of the drug that they've used for a period of time. And same thing with the child. The child goes through that same kind of problem. And it's life-threatening for both the mother and the child. So like you said, miscarriages, stillborn, again, placental issues, all of that can occur. And that can cause the fetus to abort or whatever. Yeah, it's not a good thing.
So improving engagement in treatment, part of the problem with getting patients into treatment is there's a stigma and bias among healthcare providers that can result in the underreporting of drug use and insufficient medication dosing, which often lead to ineffective or delayed treatment for mothers and for babies. Another huge disincentive is that 18 states classify maternal drug use as child abuse, and 3 states consider it as a reason for involuntary hospitalization. This decreases the incentive for women to actually seek treatment during pregnancy. Studies show that women who are allowed to stay with their children during treatment are more likely to start treatment and maintain abstinence after their treatment.